I'm Leah Brennan, I'm a clinical psychologist and I work in paediatric diabetes. Today I'm meeting with some young people to talk with them about their emotional well-being. It's really important for young people who have type 1 diabetes to also be meeting with a clinical psychologist, and that's because research tells us that having a diagnosis of type 1 diabetes means that they're more at risk for anxiety, depression and eating disorders than other young people their age. So having somebody outside of their family to talk to about diabetes means that they are able to express their worries and their concerns, talk more openly, sometimes about their family, and sometimes young people are concerned about adding stress to their parents when they already see them stressed dealing with the diabetes management.
I'm Paige, I'm 13 and I got diagnosed with diabetes when I was 7 years old. At the moment, Leah's helping me battle anxiety. At school, there's a lot of people who stare when I test my sugar levels.
We sometimes use a process called externalization, which means talking about diabetes as if it exists outside of the young person, and then that helps us to think about the relationship the young person or the family have with diabetes. I try and do that creatively and make it fun, especially for our younger patients. I have a series of dragon pictures that I use. We tend to think about diabetes as a dragon because dragons can shapeshift and take many different forms, and they can be big or they can be small pets that live in the corner. Sometimes we write stories about how and when the dragon came into their life, how other people reacted to it, and how they've learnt to accept it and live with it.
More that one because it looks like it's like standing up for itself, and I feel like that's like what I've been doing. I've been standing up to diabetes and not like letting it control my life. Leah has helped me by giving me different strategies to cope with anxiety, and they have proven to be really useful. I feel definitely more in control.
With older children, that might involve some cognitive behavioural strategies to manage anxiety and depression, or if there's eating disorder issues, then that might involve a referral to a specialist eating disorders team. We look at how their emotional well-being is impacting on their day-to-day life, as well as how it interacts with the everyday management of type 1 diabetes.
I'm Lucretia, I'm 16 and I was first diagnosed with diabetes when I was 1. The first time I came to see Leah I was a bit nervous because I've seen her in clinic before but I never spoke to her by myself. Leah and I talk about my diabetes, my relationship with people and generally my mood. It sometimes makes you feel not normal and you've got to kind of segregate yourself from your friends.
What do you mean by that?
You have to take time away from, say if you're laughing with your friends and then you have to take blood, you've got to take time away from them and that can be quite isolating.
The other thing I wanted to check in with was around eating. Where's things at now with that? What are your thoughts about food and weight and just sort of checking in about it?
I'm always a bit conscious about my weight. I think that's a pretty normal thing for a girl.
Because we ask you to focus on food, don't we? We ask you to count your carbs and to look at what you're eating and to eat at certain times, and I wonder how those two things go together.
I think it can make you a bit more conscious about it because you're actually looking more into detail what you're eating.
Thank you for being really honest about that.
When I was experiencing low moods and trouble dealing with my diabetes, Leah taught me to try and get my dad more involved to help me, and that made me feel a bit better.
Coming to see me and learning some skills and strategies can help a young person with their relationships at school, with their friends. It can help improve the relationships at home, and it can also help them to feel more empowered and more in control of their type 1 and how they're managing it.
Before I felt quite alone dealing with my diabetes, but now I feel a bit more supported by friends and family.